Chances are you or someone you know has had an X-ray, a CAT scan, or an MRI. Basically a picture of your medical problem. But that technology hasn't always painted the whole picture until now.
3D technology allows us to take the traditional imaging that we've always done, but instead of looking at it in a 2D kind of static way, we can take the information and manipulate it.
Radiologists use scanning equipment to take pictures of a trouble spot. That section is scanned in slices. With three-dimensional technology, those image slices are then molded together to form a complete picture.
Whether it's the abdomen, the liver, the aorta, the chest, the lungs, we can recreate the anatomy as if you were looking actually at the patient.
The ability to recreate a patient's anatomy is especially helpful when looking for blockages in tiny blood vessels. The two-dimensional world of radiology made locating those blockages a bit more complex for doctor and patient.
Before we had to do an arteriogram, which is an invasive procedure with catheters and contrast dye and risk of bleeding or doing damage. With this, all we do is start an IV, inject the contrast, acquire the data, and then the real beauty of this is all this is done after the fact. We have a set of data that we can manipulate. We can do it after the patient leaves. No additional radiation exposure to the patient. It's non-invasive, but we can see the same things that we saw in the past with invasive procedures.
3D technology can also be applied when checking out a fracture. With X-rays, what you see is what you get, or rather, all you get. 3D technology allows a radiologist to see more, that is, what they need to see.
We can take parts of the bone off that are blocking our view, spin it around, and see that fracture in a very anatomic way.
It's a marvel of medical science that's saving lives. Carolyn Searcy's run-in with 3D technology started with her feeling run down.
I would start to do some things, at home that I've always done, and I'd just run out of breath and have to sit down for a little while. And sometimes I would even get really nauseous with it. And so I just thought, something's going on here.
Carolyn was right. On her doctor's advice, she agreed to a scan called HeartScore, which detects calcium buildup in the coronary arteries. Once 3D technology was applied, her doctor realized she needed a triple bypass. This cutting-edge tool is not only giving doctors a clearer view, it's helping to give patients a better perspective as well. Carolyn is thankful for the technology that's allowing her more time to enjoy the important things in her life.
One of my little 4-year-old grandsons called. They wanted to talk to me. That really made me realize, I want to be around to see this little boy grow up, and I want to be a part of his life.
For Smart Medicine, I'm Rod Starnes.